Welcome to the university. I'm Nick Braisby, the Vice-Chancellor of Buckinghamshire University, and it's a very great pleasure for me to welcome you to the university this evening. It's a particular delight to welcome back some old friends, not in a pejorative sense, I should say, and a real pleasure, of course, to see so many new friends coming to the university this evening. So to all of our guests, many of whom have travelled from afar, thank you very much for joining us on what will be a very special occasion. Inaugural lectures, such as tonight's, represent a really important milestone in an academic's career, where, after having become a professor, we call upon them to profess on the subject about which they are so passionate. And in the spirit of an inaugural, we also look to reflect on the journey they've taken to achieve such academic distinction. We've got some sound effects as well. Never mind, we'll just talk louder. Yes. We'll just talk louder. So look, this evening I'm delighted to introduce Will Broughton, Professor of Paramedicine. Will started his higher education journey at the University of Hertfordshire, and we won't hold that against you, Will. Where you undertook where Will undertook his undergraduate degree in paramedic science, before continuing his studies at Anglia Ruskin, at Imperial College, again at the University of Hertfordshire, and also here at Buckinghamshire New University. Will registered as a paramedic in 2013, and he continues to hold frontline clinical roles with two NHS ambulance services in London and Oxfordshire. He is very highly regarded within the field of paramedicine. He is a fellow of the College of Paramedics, a paramedic expert witness, advising on things such as breach of duty and clinical negligence, and he has served on numerous national and international bodies representing paramedicine in the NHS, for example. So tonight, Will reflect on his personal and intellectual journey. He will take us from the origins of paramedicine to its future, and along the way touch on technology, leadership, policy and research. Talking about Beyond the Sirens, the unique and evolving nature of paramedicine, please welcome Professor Will Broughton.
Good evening. I wasn't quite expecting this many people to be here, which but it's a wonderful thing, and I'm very pleased to be speaking to you about a subject and a profession that I'm very passionate about. When people hear the sirens, they often think of paramedics rushing to save lives in emergencies, but there's so much more happening in paramedicine today. We're transitioning very much from providers of emergency care to a much broader healthcare role, contributing to in-hospital and out-of-hospital care across the system. And I'm hoping that by the end of this presentation, you will have gained some insight into what is unique about being a paramedic and unique about paramedicine, and where the profession is going. Now, when you Google the word paramedic, this is what comes up. Other search engines are available, but this is very much the public's view of paramedics and paramedicine. And I'm sure, a quick show of hands, who has ever used the word ambulance driver in conversation? Be honest, don't worry. I won't take offence. Now, we ourselves can call ourselves ambulance drivers, and I'll touch a little bit on ambulance driving in part of the presentation. But this is very much the public and indeed, to an extent, the politician's view of what a paramedic is. Then when you Google paramedicine, which is a little bit more of a contemporary term, the same thing happens again. Slightly similar images, much more diverse than images like this would have been even 10 years ago in terms of who is working as a paramedic and where they are practicing this profession. We can probably trace our origins back to battlefield medicine and stretcher bearers in the war. That's where first aid and the idea of providing an emergency medical response probably began. And we've transitioned now to a very I'll say modern, a very modern healthcare system, particularly in the NHS in the UK. But we have important origins. And the first publication that probably touched on this back in 1976 was looking at the urban mobile resuscitation service that was established in England. And there's many different origins to the paramedic story, both in the UK and overseas. And some will attribute and attribute correctly the early origins of paramedic practice in the UK to a key individual, Professor Douglas Chamberlain, who worked as a professor of cardiology down in the south, and who invented took part in inventing the mobile defibrillator. The first one didn't work, so they put the defibrillator on the ambulance and took it to the patient's house, and they plugged it into the mains as they had to back then, and it blew up. Which wasn't very good for the patient, I might add, but everything has to start somewhere, and it started with this idea that, well, the defibrillator was inside the hospital and actually the patients required it in their own home, so how might we go about doing that? Of course, defibrillators have evolved today to essentially fit in your pocket, and you'll have seen them around towns, organisations, businesses up on the wall as such an important intervention for when someone has an unfortunate cardiac arrest in a public place. When we dig into some of the patient types that were being seen in 1976, it was very much an emergency service. They were responding to road accidents, to cardiac disease and drug overdose, to surgical emergencies, and sadly some patients dying on arrival. And what you'll notice from the objective, so providing comprehensive and skilled mobile resuscitation service sounds reasonable, within the area served by the hospital for all patients. And then the second point, which is interesting still, to train ambulance men, specifically men, in both the basic and sophisticated techniques of resuscitation, assuming that no other person could possibly do resuscitation. And the profession was largely male in the beginning. It was a predominantly male workforce, very much considered working class, a blue-collar profession, and it has evolved into the wonderful profession that it is today. And we've seen, at this university, just through the admissions process, actually this ambulance men view of what paramedics and paramedicine might have been has completely turned on its head. And I would say quite confidently most, if not all, university paramedic courses now have a majority female cohort, which is fantastic to see, because that really does show how a profession has grown. I've included lots of images in this presentation, and just to share what an ambulance would have looked like back in the 70s on your left-hand side, and some of the equipment that they would have carried, to a much more modern ambulance that we see today. Although I failed immediately because there's 4 blokes stood on the screen. But very much the equipment, rudimentary, aimed at transporting patients from the scene of their accident or their emergency to a hospital for further care. And now the ambulance, it all told, this is about £180,000 worth of equipment, including the ambulance itself, to really provide care to patients where they become ill or injured and take the hospital to the patient. This was an interesting slide for me to put together, just looking at the journey of our profession. We're quite a new profession. We're new to the academy, we're new to higher education, we're new to being a profession, because for a long time it was blue collar, ambulance driver, transport service, picking patients up, taking them to the hospital. And we've done a lot in a very short space of time. So back in 1996, the first part-time degree programme was starting at the University of Hertfordshire, which then went on to a full-time programme in 1998. It was only in 2000, so only 24 years ago, which if you consider other professions, medicine, nursing, have been registered and had regulation for a significant period of time before the year 2000. So we've only been a registered profession for 24 years. On becoming a profession, the British Paramedic Association was formed, now the College of Paramedics, and there was just shy of 9,000 paramedics that transferred onto the register with the Health and Care Professions Council. In 2006, the first curriculum for paramedics was published by the College of Paramedics, And then in 2009, the College of Paramedics was formed. 2012, a report was commissioned that actually involved this university. So it was Professor Mary Lovegrove, who was a former professor here, now independent consultant, was commissioned to do the PEAK report, which was looking at really making the case for paramedics moving towards higher education as the minimum standard for entry. And that's what the report recommended. It was only in 2015 that we had our first research conference and the first editor of our British Paramedic Journal was appointed. In 2018, we achieved something quicker than any other profession, which was independent prescribing status for paramedics. It took many, many years for other professions to achieve that. We were knocked back the first time. There was a lot of opposition, including at very high levels in government. Why on earth do the ambulance drivers need to prescribe medicines? Surely they should just be taking people to the hospital and let the doctors do that. And that was the level of conversation that was occurring in government when we were trying to put this legislation past. So it was knocked back the first time. We didn't rest on our laurels, and we tried again and were successful in 2018. It's also when the HCPC, Health and Care Professions Council, our regulator, decided that degree entry was to be the minimum standard, and that was a very important milestone in the profession. 2019, the first head of research. 2021, the recommendations of the PEAK report fully implemented and degree education required, coinciding with when our paramedic science programme started here at BNU. And fast forward to 2024, just over 37,600 paramedics registered in the UK, making up about 11% of all allied health professionals. And we fall under that umbrella term, allied healthcare professional. There's 14 in total. And just one person responsible for representing all 14 professions at a government level, which I'll touch on later. And very proudly in this year, the College of Paramedics received its Royal Charter, which is the first step to becoming a Royal College. People will be familiar with some of the medical Royal Colleges, the Royal College of Surgeons, the Royal College of Physicians. Again, they've existed for hundreds of years. We've done it in about 24, which I think is fantastic, and shows the confidence that paramedics have to really push boundaries, to really break glass ceilings and get some of these important milestones over the line. It's not just about speed, but some of these things are really important for patients as well. I was thinking about how paramedicine would be defined, and I dug this page out of some colleagues will remember this. This is from the 2008 Ambulance Basic Training Manual. This was the Bible that we were given when we started our training, when I started in 2009. And what we were guided by were these three principles, the principles of ambulance aid. Preserve life, makes sense. Prevent deterioration, and do so without careless handling. I love the wording of things that you get in some of these old documents, and although it was only 2008 that this was published. And then promote recovery, providing the correct treatment management, nursing and reassurance. So even in 2008, we were looking at how paramedics were providing care across a spectrum. It wasn't just first aid, it was everything that the patient would need before they arrived at hospital. Colleagues in 2023 published a paper looking at exploring paramedic professional identity, and one of the key things that they pulled out of that paper was this alignment with the ambulance service, with our origins, that even though paramedics are doing many more things than they ever were and working in far more environments than just an ambulance service, it is the beginning of your career in an ambulance service that becomes very important for how you then move on as a professional. Colleagues in Australia then led a Delphi study, so a really big study taking on board the feedback of many different stakeholders to come up with what their definition of paramedicine would be. It's quite wordy, but I'll go through it. Paramedicine is a domain of practice and health profession that specialises across a range of settings, including but not limited to emergency and primary care. Paramedics work in a variety of clinical settings, such as emergency medical services, ambulance services, hospitals and clinics, as well as non-clinical roles such as education, leadership, public health and research. Paramedics possess complex knowledge and skills, a broad scope of practice, and are essential part of the healthcare system. Depending on location, paramedics may practice under medical direction or independently, often in unscheduled, unpredictable and dynamic settings. And it's those final three words that really, I think, capture some of the essence of what a paramedic is. Unscheduled, unpredictable and dynamic. We have to be able to adapt and change our approach, our response, our practice to the situation that is presenting itself to us at that time. A good friend and colleague from Canada, J.D. Heffen, he's the chief paramedic for Indigenous Services in Canada, likens the paramedic to the Swiss Army knife, providing all of the things that you might need at the point in time that you need it. And uses this as an analogy to describe really how paramedicine has evolved immensely over a relatively short period of time. And whether we're thinking about identity or skill set or scope of practice, paramedics are able to adapt and overcome based on what their community needs. And the other way to look at that is that we're a bit of a jack of all trades, and the rest of that is a master of none, which was originally thought of as an insult to William Shakespeare, no less. I think this does fit. We have to be able to respond across a range of different settings and circumstances. We have to provide care in often very challenging and very unpredictable environments. And we can't be a master of anything, because to do so would require in itself a degree in nursing, a degree in medicine, a degree in midwifery. And I'm very pleased to have colleagues from other professions here this evening as well. So that's just setting the scene. For those who aren't necessarily sure of the paramedic journey, I hope that's given you a bit of insight into where we've come from and some of the things that are unique about being a paramedic. Now, I was told that I have to talk about myself in these things. So I'm going to give a little bit of a story of my journey to Professor of Paramedicine and in our short time as a profession, just the second chair of paramedicine in the UK. So, back one step, where do professors come from and where does professorship begin? Well, according to the Oxford English Dictionary, the title professor has evolved from being a synonym of magister or doctor, denoting someone qualified to teach, to imply distinction within a gradually developing hierarchy of teachers. That's where the origin is. And in the UK, we use the term professor and chair fairly synonymously. And I'm one of those professors of practice rather than research. And I'm going to talk a little bit about what that means. I'll tell you where this definition came from after I've gone through it. Professor of practice is a position in many institutions filled by individuals with significant professional experience. These professors bring real-world expertise to the classroom. Some key characteristics are professional experience, teaching focus, and bridging that gap between academic practice and their industry. I liked this bit. Their presence enriches academic programs. I'd like to think that is what a professor, and at this university, what having a professor of paramedicine means to our paramedic program. Where did this come from? Well, it came from AI. So I asked ChatGPT to give me a definition of what is a professor of practice, because it differs between institutions and it differs worldwide as to what would be required to become a professor. It changes significantly depending on where you are and where you work. A little bit more of my journey. So I'm going to talk you through some of the things that I've done. And this slide took ages. This took a really long time to pull together. And I kept remembering other things, which is why some of the logos end up being a bit smaller than others. But where did this all begin? Well, it began as a volunteer with the British Red Cross. I went along and did a first aid course and started volunteering at public events and helping out evenings, weekends, at things for free, providing first aids to the public. And quite enjoyed that. Did some extended training and became what they called an ambulance crew member, which meant that I could both drive the ambulance and work on it, so that was quite important. And I really do value the time that I spent volunteering with the Red Cross. I really do. It gave me some phenomenal opportunities and experiences, not least managing the entire medical provision at a fantastic festival called Glastonbury Budget. If you are on a budget and you can't quite make the real Glastonbury, then I highly recommend it. It's a festival up in Leicestershire that happens every year. A really, really fun event. And it was great to command the medical provision at that festival. That's what inspired me to think, I quite like this, providing healthcare outside of a hospital, in a field, in slightly austere circumstances. So I applied to university. Was only offered a place at one university, University of Hertfordshire. The other four said no, but I'm very grateful to Hertfordshire for saying yes. It really did set me on the path to where I've got to today. And started my clinical career with London Ambulance Service. So I was a student paramedic working in London, did a 4-year course, so it was still a Bachelor of Science degree, but 4 years where our third year was spent working full-time as an ambulance technician, and then we came back to university to finish our course. The financial pressures of a 4-year course meant that it could no longer continue, but we'd love to see that sort of model come back with a full year of work placement, because it really did prepare me for what I then had to do at the end. While I was a student, with some colleagues, founded the first Student Paramedic Society in the country and went on to found and deliver the first UK Student Paramedic Conference for all student paramedics across the UK, which was then adopted by the College of Paramedics and is now an annual event. And I talk about the importance of that year as an ambulance technician, because unlike now, if you qualify as a paramedic today, you join an ambulance service and you start a preceptorship, a 2-year period where, to an extent, you're looked after a little bit more than you used to be. My preceptorship was 3 days with the person that mentored me as a student, and then off you go. Here's a bag full of medicines, here's an ambulance, here's a colleague to work with. Good luck, go and be a paramedic. And within 6 weeks, I then found myself working on my own on a response car, responding to emergencies as a solo paramedic. Moderately terrifying, but was made less so because of the experience that I'd gained at university. So I stayed with London Ambulance Service for the beginning of my clinical career, and then during an elective placement in my undergraduate studies went to a paediatric emergency department and saw where paramedics weren't delivering the best care to children, but also just not confident in delivering care to children. That was the key thing, confidence. They were bringing children to the emergency department, not because there was anything wrong with the child, but because they weren't confident to make the decision to discharge them. So looked around to see what master's degrees were available. There was one in paediatrics and child health. It was at Imperial College, and I thought, Imperial College, that's up there in the league tables. They do medicine, they do some pretty big courses, they've got a strong research profile. The course was pitched at doctors, but I chucked an application in and was successful. And was the first non-physician to join the MSc in Paediatrics and Child Health at Imperial College, and thoroughly enjoyed my time, used that as a springboard to go and work in the Paediatric Emergency Department at St Mary's in Paddington. And at the same time started to become involved in the College of Paramedics. As things happen, sometimes I was tapped on the shoulder, you'd be quite good at looking after the London region as the assistant. I thought, okay, that's fine, I can assist someone to look after members in the London region. Very swiftly, the person doing it moved up and they said, right, London, it's yours. So I became the council member for London, looking after all of the members in the London region and providing CPD events across the capital for paramedics. I then moved to Anglia Ruskin University to start a part-time lecturer position. Was fortunate because of my paediatric background to join a guideline development group with the UK Ambulance Service Clinical Practice Guidelines. And I suppose that was really my first publication, authorship in the UK Ambulance Service Clinical Practice Guidelines, our national pocketbook for what to do and how to do it. I stayed with the College of Paramedics as a council member, then becoming a trustee and the Director of Professional Standards, and started doing some work as an expert witness. Again, there was no paramedics that were experts in children, and a colleague had a case that needed an opinion that involved, sadly, something that had gone wrong with a child. And I've been doing that since 2015. 15 now, and it just gives me fascinating insight into some of the things that we need to be mindful of in an education setting, things that are going wrong and acknowledging that they might have gone wrong, but using that learning to put that back into the curriculum and to benefit our students. I then, from Anglia Ruskin, resigned without a job to go to. I didn't have the best time towards the end and took a big gamble. The dean at the time said, "Oh, where are you going next?" I said, "I'm not sure," which is an important thing about taking risks in your career. There has to be some risk-taking, I think, to reap some of the rewards. And one of the rewards was my first then visit to Sri Lanka to help them develop their emerging national ambulance service, and had a very fascinating trip to the northern province to a town called Jaffna to give some advice and see what we might be able to do to help them develop their ambulance service. I then returned to the University of Hertfordshire as a senior lecturer, started working in Oxfordshire and did a little bit in 111. Some frontline colleagues will be shuddering at the thought. 111 is the telephone service. Some paramedics thrive in that setting, others just do not enjoy the interaction over the phone at all. And had a wonderful opportunity to contribute to some core paramedic textbooks with the National Association of EMTs over in the States and Class Publishing here in the UK. That led on to what is now an established partnership with the National Ambulance Service in Sri Lanka. BNU have been out twice now to support their training and development and working towards an established and ongoing relationship to help them grow their provision. Then I joined BNU. Paul and I were reflecting. I joined BNU during COVID. So I arrived, picked up my laptop, went home, only met colleagues on a screen for 6 months. It was a very strange way to start a new job, and was very grateful to Paul and the university for giving me the opportunity to promote from a senior lecturer post at the University of Hertfordshire and come here as an associate professor. That's allowed me to work with other organisations, NHS England, NIHR, the National Institute for Health Research, as a deputy chair of one of their research prioritisation committees, the Healthcare Leadership Academy, the Ministry of Defence. There's a point to all of this that's coming. I've really enjoyed doing all of this. It looks like a lot, and it has been busy, and people sometimes ask me how, why, and it was because I enjoyed it all, and I found great benefits in doing a range of different roles over time. Now, a few stories from practice. So I've been very, I'll say fortunate. I'm looking at Mark, who's shuddering again at the thought of this. Some paramedics don't like delivering babies. I've delivered 4 successfully, brought 4 lives into the world, and it's honestly what a privilege. And reflected recently about there's only a handful of people that bring children into the world. It's paramedics, midwives, predominantly midwives. I'll add. Carla's here. Physicians with a particular specialty, and our ambulance call handlers who then instruct the relative of somebody how to deliver a baby over the phone. Far more challenging than doing it in somebody's front room, but nonetheless an important and unique part of being a paramedic. I was fortunate again to work as a paramedic at the Queen's funeral and provide the emergency medical response to that. I provided all of one plaster to one police officer who had a blister, but they were very grateful. If anyone's been to a large gathering in London, this is Notting Hill Carnival. Again, a fantastic opportunity for paramedics to work in a very, very complex and challenging environment. Around 1.2 million people kind of penned into a small part of West London for 2 days. And I chose this particular image just because it contained a lorry, and thinking about the unpredictable, the challenging, the dynamic nature of being a paramedic is that we had a patient in a similar setting to this, and you can see how difficult that might be to move them to a treatment facility. So a bit of quick thinking, and we decided to put the patient onto the lorry because it was going in the direction of the treatment centre. So on the patient goes, and off we go, not having to walk and carry the patient through the crowd until we got to our stop, and we got off and took the patient to the treatment centre. And of course, there's a some would say sad, but also a wonderful opportunity for paramedics to care for patients at the end of their life. And it's something that we've done for a long time, but as paramedics we're now doing more and more, caring for patients at the end of their life. Again, I've had the privilege of sitting with patients, holding their hand whilst they die and giving them a good death. And that is really, really important and a very powerful role that I don't underestimate at all. I've been very fortunate to do some other travelling. We took some students and colleagues over to New Orleans and had a great time with their ambulance service and attending a conference over there. Again, providing some support, not just in terms of education and training, but equipment to the ambulance service in Sri Lanka. Driving ambulances is fun. Don't let anybody tell you otherwise. It is very, very fun driving on blue lights through central London. Going down to Buckingham Palace if you can kind of steer your ambulance in that direction, yeah, it's fun. Don't let anybody tell you otherwise. And it is an important part of the role, but only when working as part of an ambulance service. And then occasionally, I was trying to find a picture of describing some of the fights that we have as paramedics, and we do occasionally, and unfortunately, fight with patients to save their life, and we fight with relatives, not in the physical sense, although sometimes it does escalate to that. This is the unpredictable nature. A patient at 50 miles an hour in the back of the ambulance deciding they want to get out, we have to take fairly swift and decisive action to sit them back down, to stop them jumping onto the motorway. And it does make this profession very unique. I've attended one major incident as a paramedic. This was when the Apollo Theatre collapsed, the roof of the Apollo Theatre collapsed in central London. No injuries at all. We commandeered several London buses. There was more ambulances than we'd ever seen sent to look after patients. And a very significant failure in communication, which you won't see published anywhere, but someone decided that all patients had to be seen by a doctor before they left. And there was only one poor helicopter doctor who had to then see every single patient for no reason at all. This was just a failure in communication between people, and the end result was the doctor needed to see everybody. Not the case at all. My wife stepped out, but I've also been very fortunate to work on shift with my wife on more than one occasion. This is us on New Year's Eve, claiming some fairly significant overtime that's occasionally offered in the NHS. And we were both very proud that we managed to get a pizza delivered to the emergency department on New Year's Eve so that we could have a meal before we went to see our next patient. This was me having a great time over in Cyprus. They picked I told them that I didn't like the sun, and they said, great, we've got just the scenario for you. I was a judge at a competition, and they said, yes, there's this little island out in the sea with no cover, no shade, no trees, no nothing. Could you go and spend 5 hours there judging this competition? Finally, another unique nature of paramedicine. A different New Year's Eve, I responded to a patient who was worried and was anxious, and the call had come to me as difficulty in breathing and chest pain, and I was working on the car on my own. I'll skip to the good part. The problem was that their sink was blocked, and at 1 o'clock in the morning on New Year's Eve, you can't get anyone from the council to come and unblock your sink. So I was on that occasion a blue light plumber, and took the U-bend off, cleared it out, put it back together, whilst the older lady made a cup of tea, sat with her, had a cup of tea and a biscuit, heard about her life, and then went to the next patient. And some will say, what an outrageous use of emergency resources. But that patient was genuinely anxious and genuinely needed some help. The help was this, and I was able to do it. Some paramedics may not have looked to do emergency plumbing. And don't get any ideas. You can't ring 999 to get your leaks fixed. But it's just trying to illustrate to you the unique nature. This was a wonderful opportunity in Sri Lanka to deliver some education for their version of the British Red Cross. So you'll have heard of St John Ambulance. They're quite prolific in the UK. They also exist in Sri Lanka, and we were wandering around a temple festival one evening, and they said, could you come and do some CPR training for us? We've not had anybody of your calibre deliver this training for us. So myself and a colleague spent our weekend delivering some training to, again, volunteers, people giving up their time to look after other people. This built up to 2021, where I was absolutely honoured to receive a fellowship of the College of Paramedics, and for the commitment to developing the paramedic profession, a lot of which happens behind the scenes. It's often the case with these things that there's an awful lot going on that people don't know and may never know about, but very, very honoured to receive that award. And then some people in the audience will recognise themselves in this picture. Yes, you've been mentioned. This year, fantastic for BNU, we graduated our first cohort of paramedic science students that have been through the course that was designed at a distance in COVID under some challenging circumstances, and it was truly wonderful to see the first cohort walk across the stage this year. And as you can see, they had a fantastic time, and very pleased to see some of them in the audience this evening. And so that's given you a bit of a snapshot, I hope, of my journey to becoming a professor and finding myself now very comfortable in the academy, working in a higher education institution, providing education. And what all of this examples were designed to demonstrate is range. I don't know if anybody's read this book. I've read it 2 or 3 times now, and it talks about the breadth of training, predicting the breadth of transfer, and that is the more context in which something is learned and practiced and demonstrated, the more a learner is going to be able to create different models to deal with particular problems and particularly challenging problems. And in this way, the breadth of paramedic training, education, experience is what enables a paramedic to better apply their knowledge to situations that they've never encountered. We run some fantastic simulation weeks and activities here at BNU. There's a cost to doing that. It's very expensive, but it's very important, because without it, we can't adequately prepare people and give them the tools, the resources, the knowledge they need to deal with some of those complicated scenarios that they will have to encounter for the first time. We can't simulate everything. We can't practice everything before somebody leaves. We can do our best, and we can give you the tools to do that. But when facing uncertain environments and wicked problems, the breadth of experience that somebody has is absolutely invaluable. And I pulled this quote out of the book from a different author, Professor Angela Duckworth, who talks about specialisation having some benefits, but before specialisation comes sampling, the exploration of possibilities that really you cannot know anything about until you try them. Professor Duckworth says, don't confuse the healthy development of a work ethic with the premature commitment to a singular passion. And I read that and thought, that's what I've done. I've sampled lots of things. I've taken the opportunities over the years to try different things, find out what I enjoyed, what I was good at, what I had a passion for, and really enjoyed doing it along the way. Some of you, some eagle-eyed viewers at the beginning will have noticed that there's a qualification missing from my list of things underneath my name. And I am one of those professors who doesn't yet have a doctorate. When I met with Nick, our Vice-Chancellor, to have a conversation about becoming a professor, he very kindly made it a condition. Non-binding, I don't think. I haven't seen it in my contract. I haven't seen it in my contract, but a condition nonetheless to achieve a PhD and complete some doctoral study, which I'm committed to doing. By my watch, I've got about 35 years of career left, so it will be done before I retire, and I hope to add that to the list in the future, because I do think it's an important endeavour and I do want to do it. But what a PhD requires is hyper-specialisation. You can't really do a PhD in broad things. It needs to have some focus, and it needs to have a direction. And I think part of me has been slightly worried about choosing something so hyper-specialist, because I do enjoy the breadth of what being a paramedic allows me to do. For a long time, the paramedic scope of practice, the paramedic that people would see out in the world was defined by the skills that they were able to perform. The paramedics in the room will know this is one of the most contentious skills going. It's also one of the most highly researched things. We know the answer to all of this, but yet it continues to be researched. And this is endotracheal intubation. This is passing a tube through a patient's mouth into their trachea, their windpipe, so that we can take over their breathing. It was a skill that really defined paramedic practice. It was the thing that a paramedic had to achieve before they could call themselves a paramedic. And now they've taken it away because the evidence would suggest that it's not a particularly good intervention for some patients. But there are still some patients who would benefit. So whilst we've for a long time been defined by the skills that we are able to perform, really we're looking now at defining paramedics by what they do and where they do it. The College of Paramedics has ran for a couple of years now a very successful campaign called Not All Paramedics Wear Green. And I won't go through all of these, but there's a few colleagues, some colleagues in the room might recognise some of the faces on the screen. But paramedics are working everywhere now, not just in ambulance service, not just in hospital settings, but in GP surgeries, on cruise ships, in the military, in remote expeditions, on search and rescue helicopters, in positions of leadership. It's fantastic that our Chief Executive of the College of Paramedics is a paramedic herself. Working across education, policy, research, paramedics are everywhere. And I think it is our confidence and our tenacity that has allowed us to start occupying some of those positions so successfully. And the College of Paramedics has a wonderful career framework that gives an awful lot of choice and option to paramedics. I'm very fortunate that I've made it to the middle. I'll just go back one. I've made it to the middle, which is fantastic. And why that's fantastic is that it means I get to do all four things around the edge. And by working in a university, I get to have the most amount of influence on the people at the very beginning, the newly registered paramedics, the students that are coming into this profession. And I've got a fantastic opportunity in this role, with this title, with this position, to support the growth of the paramedic profession in all four domains of practice. I said in the flyer that I'd talk about technology. I found this image quite suitable. Those of you that chuckled will know this as Star Trek and Dr. McCoy. And this device, the tricorder, where they would scan the patient, and this mysterious machine would tell them everything that was wrong with the patient. And we often wished for something that would provide us with such certainty about what might be wrong with someone. And one of the things that was supposedly said by Dr. McCoy was that compassion, that's the one thing no machine has ever had, and maybe it's the one thing that keeps people ahead of the machines. But we do have now machines that can do this for us. We have ultrasound machines that plug into your phone so that we can scan your internal organs and have a look at what's going on at the roadside, something that previously ultrasound machines would have been far too large to put on an ambulance, and certainly far too large to take to the roadside or to where a patient was injured. We've got blood testing devices, again, confined to the hospital setting for a very long time, and now we've got the ability to do those tests at the patient's side. And you see that I use AI. I asked AI to produce an image of what the future of technology might look like for paramedicine. And you'll see that AI is not quite there. The image quality is pretty poor. It's not quite got it right. For some reason, it's put ambulances inside this control room. But what it's thinking about is it's showing what could be possible. We're thinking about telemedicine, telehealthcare, mobile integrated care, providing patients with a little sticky patch that then feeds their vital signs and their important information back to a control room, so we know if they have some deterioration. We're starting to use data in ways that we never have done before to have predictive analytics in our control rooms to think about how we target the best resources to the patient who needs it most, because you will have seen in the news the health service is under a little bit of pressure, ambulance services are under a significant amount of pressure, and responding to patients in a timely manner is a challenge. So we've got to embrace technological solutions and advancements to make sure that our response to patients is protected. I said I'd talk a bit about policy and leadership. There was a paper published this year that looked at exploration and representation of allied health professions in senior leadership positions in the UK. And it included just one paramedic. Now, I would put it to the authors if they were here, they didn't try very hard to find paramedics that are in senior leadership positions, because I know of all of these people who occupy either chief paramedic or paramedic director posts across the UK. And on reading the paper, it looked like they'd missed out ambulance services when they contacted NHS Trust to see where those senior leaders might have existed. You'll see at the top of the table is the physiotherapy profession, 51 senior leaders. Now, it's important because the Chartered Society of Physiotherapy, the equivalent of our College of Paramedics, was founded in 1894 and given royal status in 1920. So they've existed for quite a bit longer. So it's fairly reasonable that there's quite a few more in senior leadership positions, but it's something that we need to address. Most ambulance services now have a chief paramedic, but not all. And there's a very strong recommendation from NHS England that they all do appoint a chief paramedic. We do need our regulatory frameworks. We do need to think about how policies and how the scope of practice might expand. We do need to have more paramedics attending environments and settings like this to get the message across that we are more than just ambulance drivers. The paramedic profession has evolved and continues to evolve and has a very important role to play in providing healthcare across a very complex system, particularly in the UK. The journey is very much on for paramedics in a research context. We're doing an awful lot more than we ever were to produce paramedic-led research, and that's very important. For a long time, paramedics were joining research studies and contributing as research participants, but they weren't leading the research. Now, more than ever, in the UK and worldwide, there are more paramedics leading research than ever before. But we are a new profession. This is why there's one reason, I think anyway, why there's only 2 substantive professors of paramedicine in the UK. We are still a new profession, the research is still evolving, the opportunities for paramedics to take on these positions and demonstrate that they've met the requirements to achieve those roles and those titles continues to grow, but we're catching up very quickly. We must always remember our origins and I didn't build this slide, I borrowed this from my wife, but this quote from Isaac Newton, if I've seen further, it's by standing on the shoulders of giants. And there have been some pretty important giants in the world of paramedicine. Far too many to list and put on a slide here, but without them, we wouldn't be where we are today. And we must always remember our origins as professionals. The future of paramedicine, where are we going? What are we going to do? Well, we're providing much more long-term care. We're providing much more care in the community. We are having much greater involvement in mental health provision, in public health, a growing engagement in disaster response. And I was asking myself, what is the paramedic brand? And we've created a bit of a monster, really, because if you phone 999 and you need an ambulance and you say the right things and the triage system gives you a response, someone may well turn up the same day, which is actually quite a good service compared to other bits of the health system that might be quite difficult to access or difficult to engage with or difficult to get that face-to-face appointment. And what are the threats? Well, one of the biggest threats to paramedics and paramedicine, I think, is paramedics themselves, to maintain that confidence, but not allow that confidence to become arrogance in certain settings, and to continue, and I love this quote, to continue to be curious and not judgmental. Paramedics often let themselves down sometimes by judging others and worrying about being judged by other people rather than just concentrating on being curious, asking questions, doing the best that they can in sometimes very difficult circumstances. And I wanted to end this talk, and I'm very mindful of the time, by reading out this pledge. This was created by a number of different stakeholders a couple of years ago, and I hope I can do it justice. It's very small on my screen, but you can read it. I swear to fulfil, to the best of my ability, this pledge that binds together my curiosity, compassion, and humility with my duty as a paramedic. I recognise that I do not stand alone, but alongside all those who share my professional purpose. Together we walk proudly in the footsteps of those whose endeavours have developed our profession. And yet we remain inquisitive, carving our own path in pursuit of progress towards the betterment of the communities we serve. Though we are adaptable and operate with autonomy, we do not work in isolation, conscious that our very name means that we work alongside others. Our complex and austere experiences give us insight. Using this wisdom, we do everything reasonable within the boundaries of what is ethical and lawful to benefit those in our care. We tread with care in all matters of life, including death, creating enough proximity to afford empathy, yet preserving enough distance to maintain a professional boundary. We take pride in the privilege of our position. We seek to protect the rights, interests and dignity of our fellow humans, because it's our role to advocate for all people, regardless of how their values may differ from or echo our own. Although we are altruistic, we also accept our duty to be compassionate to ourselves, because we are mindful that the virtues that we strive to uphold may at times weigh heavily upon us. And if we are true to ourselves and to this pledge, then let us be known as a profession who act with integrity and equanimity in the face of challenge and complexity. Our ethos emerges from our experiences, is moulded by our curiosity, moderated by our humility, and animated by our compassion. I am a paramedic. Thank you very much, and I'll be delighted to take some questions.
Fantastic, thanks Will. Exactly what an inaugural should be, the personal, the professional, the academic, really good stuff, thank you. So we have got a few minutes for questions, so let's open up to the audience. Any questions for Will?
I'll go first.
I'm going to ask if you can stand up and
Will, first time I met you,
Yes.
I asked you a question. I'm going to ask you the same question. When are you starting your PhD?
January. Notice I didn't say which year.
Other questions?
Oh, Karen.
I'll be second. Thank you. Hello? Hello? Thank you, Will. Great presentation. From the heart, professional, everything I'd expect from you because I work with you. A question around the multidisciplinary approach. So we've got physios in the room, and midwife, nurses, and paramedic students I know, and so on. How do you think that integration of paramedicine to those other professions is really being seen? Is it where it needs to be, and is it going in the right direction?
I think so. We're working in more settings than we ever have done, and I'd like to hope that we're making a very positive contribution in those settings. We're also welcoming other professionals into our setting. We've recognised that actually pairing a paramedic with an occupational therapist on a response car to go to patients who have fallen, to look at not just the medical reason for their fall, but everything else that might be able to influence and impact on that person's care. So I think the multidisciplinary aspect is working very well. I think it's going in the right direction, but we need more of it, and we need much greater understanding of each other's roles to be able to do that. And it's a challenge. The system is under a lot of pressure. Placing student paramedics into non-ambulance settings, looking at students that have just graduated. It's a challenge because the system and healthcare is very busy. But we're not going to give up, because it's important that people get that broad experience across the health system to know how best they can look after patients and make sure that we're navigating patients through the health system appropriately.
Hello, thank you for your talk today.
highlighted obviously how paramedicine and paramedics as a profession is pretty recent, relatively speaking, and that push for registration and professionalisation within the ambulance service is something that all trusts are really looking forward to doing, is pushing people towards a paramedic role. Do you envision the future in which our ambulance services are pretty much exclusively staffed by paramedics, or where do you see the role for roles such as technicians, emergency care attendants, AAPs and so on and so forth in the future?
Good question. I think paramedic has origins in Greek language, para meaning alongside and medic being medicine. So paramedics have always worked alongside medicine, and those other roles have always worked alongside paramedics. And I think it is the non-registered workforce, as it's sometimes known, those ambulance technicians, emergency care assistants, that provide the paramedic with the environment to do some of their best work. And I mean, practically, it wouldn't be cost effective. Paramedics are quite expensive, and you do need two people to work on an ambulance. But I don't see a role where ambulance services would be only staffed by paramedics. But, and I appreciate I'm probably quite biased here, I do think there's a role in all patients having some contact with a paramedic to make sure the decisions about their care are as appropriate as they can be. And that doesn't have to be face-to-face contact, it doesn't have to be the paramedic on the ambulance for every single patient, but some contact with the paramedic to make sure that the care and the decision-making and the responsibility, because we wouldn't see that in a hospital setting. You wouldn't have a non-registered healthcare assistant healthcare worker making an independent decision to discharge a patient from a hospital. That would be made by somebody with a professional registration, and I don't think ambulance services would be wrong to require that as well. Annette?
Probably shout.
Go on.
No, what I was curious about is with your work in Sri Lanka.
Yes.
Are you seeing the same kind of role development in paramedics over in Sri Lanka that we're seeing here in the UK?
They're at a very early stage. They're probably, well, I say that, they're 20 years behind and 5 years ahead.
Oh, nice.
So the legislative framework in Sri Lanka doesn't really exist for paramedics to be a thing yet. You're just not allowed to carry medicines unless you are a doctor or a nurse. But in ways that they're ahead, ambulance services in the UK spend hundreds of millions of pounds on their dispatch system. And colleagues will know it doesn't always work quite as well as it should. And there have been some pretty catastrophic failures in the past. Sri Lanka built theirs in-house for about £50,000, and it's phenomenal. It integrates with Google Maps, so you get your traffic data as you're responding to your emergency. It provides the ambulance crew with the phone number of the patient so they can get in touch with them and just confirm the location, the directions, that kind of thing, and continue the consultation over the phone with the patient before they get there, which you'd think we'd be able to do in the UK, but we can't. There's no mechanism for us to do that. So, and they're also looking at really advanced technology like Microsoft HoloLens, the 3D goggles, so that because their system would require medical direction, there would need to be a physician making the decisions, prescribing the medicines, rather than relying on the verbal reporting of an ambulance crew. They've said, no, let's put a HoloLens on every ambulance. This is their dream and their vision. So that the physician in the control room can see what the crew is doing with the patient, can then prescribe the medicines, can recommend interventions, and support them to do that in a virtual 3D environment. We're not doing that. So it's a real, the contrast is phenomenal. 20 years behind and 5 years ahead. But what I will say is that the commitment, the motivation, the passion, I've taught lots of people over the last 10 years, and the ambulance crews in Sri Lanka are the most phenomenal people I have ever taught, because their drive, their motivation, their energy, their enthusiasm is like nothing you've ever seen when you're giving them just a one-day refresher course, and they can't get enough of the information that we're trying to give them and the practical opportunities that we're offering them. It's phenomenal.
And you'll continue working with them?
That's the plan, yes. As long as we keep finding some money to do it. We were very fortunate last year to get some money from the government to help and some funding from BNU, and we're looking at how we might do that next year.
Thank you.
If there was one piece of advice that you could give to us first year
Yes.
paramedic students, what would that be?
Whew. Just one. Yeah. Were you in the school welcome talk? Yeah, so I can't use that same bit of advice, I don't think. Goodness me. Ask lots of questions and don't be put off by people that don't like you asking questions. Keep asking them. Keep being curious, always, in every possible environment of your lecturers, of your practice educators, of the people you interact with in hospitals. Just keep asking questions, because you will find out some fantastic information just by asking questions. And yes, some people might get a little bit annoyed that are asking so many questions, but that's how learning takes place. We learn and we develop and we evolve by asking questions and being curious. So don't let anyone stop you from being curious. If they do, let me know.
Great point to finish on.
Thank you.
Will, congratulations again, and colleagues, you will join me in one round of applause, and then there's wine and milks.